Welcome to Candid Chats on Cancer. I'm Mary Robinson.
I'm Jamie Moore. Mary, who are we chatting with today?
We are chatting with Carrie Jensen, and she's actually a friend that I met in 2014 through a Time to Heal class that we had talked about in another episode. And so, how have you been? And can you tell us a little bit about your diagnosis and all that?
Yeah, you bet. So I was diagnosed in 2009, and I had follicular lymphoma is what it's called. So it's a non-Hodgkin's follicular lymphoma.
Okay, can you break that one down for us?
Yes, I can. So I think that follicular really just means it's a slow grower, which is really great news. The other side of that is I was sick for a long time before they actually diagnosed and found what it was. So when they did find it, it was in my abdomen, behind my organs, which a lot of people who have a lymphoma, it might be a lymph node in the neck or in the armpit, something that will pop out, but mine was behind my organs in the abdomen, in my heart, my bone marrow, and my liver. So I was pretty sick by the time that they found it. But the good news is, because it's a slow grower, it did respond very well to the chemotherapy that I had.
Wonderful.
So how did they find it, since it is slow growing? It was,
Well, I will tell you, I had to advocate a lot for myself in the process of discovering what it was. I did have a couple of doctors tell me that there was nothing wrong with me, to go seek psychiatric help, which was really interesting. So advocating for myself and finally saying there is something really wrong with me. So a CAT scan did show the growths, and ultimately some blood work came back, and then that led to the biopsy, which led to the diagnosis.
Yeah, I think you bring up a really great point that, our emotions sometimes tell us long before we actually see the signs and symptoms. In fact, you had anxiety coming before you got diagnosed. I had depression. It was just, I just told my wife one day, I didn't have anything to be depressed about. My practice is going well. I had just given a successful lecture, and we were sitting on the back porch on the most beautiful day, and I went, I just feel depressed.
And I was just anxious about everything, meaning that, I felt like my life was chaotic, and I know I have 4 children and whatnot, but I was just, crabby and tired, and then I thought, what is going on? Am I crazy? But I think it was just my body telling me I was sick.
Right, and so my job had me, I was driving a lot for my job. They actually called me the I-80 road warrior. I did a lot of time between here and North Platte, Nebraska, and I would be so fatigued, and that's a little different than tired, that I would have to pull over at rest areas or in a Walmart parking lot off of the interstate where there were bright lights so that I could take a nap. It was a very interesting level of tired. And then getting home from being on the road and being, I would sit still for 5 minutes and be completely asleep in the chair. And I'm a mom, so I just figured, I have 4 kids, and I figured, I have a very busy job, and I'm traveling all the time, and I've got these kids, and when I was away from home, I did work probably 18, 20 hours a day, because what else am I going to do? So I could blame it on a lot of things until I couldn't blame it on a lot of things anymore.
What made the doctors finally check you out again? Because you had said they said that it was in your head, right?
Yeah. So I switched doctors. I switched doctors 2 times before I landed on one, and I actually said, I'm not leaving here until you figure out what is wrong with me. And I really meant that. I knew something was really wrong. And then I have a really great friend who works at Nebraska Medicine, and she knew that I hadn't been feeling well, and she made some calls. She called some friends and called in a couple of favors, and I was able to get into some really fantastic doctors at the Med Center who listened and didn't write me off. And they really started digging and looking, and I'm really glad that they did.
Oh, yeah.
So what kind of testing did they do? MRIs, CAT scans?
Well, the joy thing is I had to start off with a colonoscopy and an endoscopy.
Yes,
those are so fun. Yeah, we had to rule out some other
no
things.
Fun.
Yeah, not really a lot of fun. But we had to rule out some other things before we could really get into the need to cut me open and biopsy, because that's a big deal. It's a surgery. And some blood work came back. Mostly the blood work, though, was pretty good. It's when the platelets started dropping off. With lymphoma, that's one of the indicators that there might be a problem, is when platelets start dipping and white blood counts, go high.
So your platelet count, why does that drop when you get a lymphoma?
Oh, geez, I don't know. I just think that it's part of the lymphoma, the blood cancer. It just isn't able to produce what it's supposed to produce, and that's one of the indicators. Still to this day, when I have my cancer checkups, we do those
Look
blood
at your
counts.
platelets.
Mm-hmm.
Yeah.
Mm-hmm.
So what other testing did you have after the colonoscopy? Because we all know how
That's a dream.
joy those preps are.
That's a
aren't they?
great time. They ended up doing that CAT scan and comparing it to a couple of CAT scans I'd had before, and then those were worrisome. The lymph nodes that were so big. The three biggest, one was the size of a softball, one was a baseball, and one was in between. So those were the three largest. And our lymph nodes should be the size of our thumbnail. So they
Right.
shouldn't be that big. And that led them down the path of, we need to do a biopsy. So we scheduled the biopsy. I had to wait till my son played in the state baseball tournament in 2009, in Lincoln, the Cornhusker State Games, which we won.
You gotta have your priorities straight.
I had to wait, being a mom was first for me.
That's
Yes.
right.
And then I had the surgery on a Monday, and it was diagnosed on July 22nd, about 10 after 1 in the afternoon. You never forget those
Right.
benchmarks.
Yeah.
It was also my anniversary at my company. I've been at my company
no.
for 4 years. Yeah. And they were really great during the whole fight.
Now you had something different with yours, right? After you did the chemo, and did you have radiation too?
No,
Or-
thank goodness I did not have to have
Okay.
radiation. So we did the 6 rounds of the chemo R-CHOP. I don't know what that all stands for. R stands for rituximab, and P stands for prednisone, and all the stuff in between does amazing stuff like
Yeah.
kill the cancer. Then I had 2 years of maintenance drugs, and it was the rituximab every other month for 2 years.
Okay.
But didn't that do something to your immune system?
Yeah, so now we know more that there's a little bit of a risk with the rituximab that I think might be showing its face a little bit more often, especially in patients who are younger, because my lymphoma, follicular lymphoma, tends to be diagnosed in people who are older. And there's a risk of losing your immune system. And I know
Right.
we talked about the risks when we're talking about doing chemo, but all I was hearing was, you have cancer, we found cancer, it's
Right.
cancer.
And you probably just wanted it out.
Oh, get it
Yeah,
out.
get it
I
out.
don't care what we have to do.
Yes.
Whatever the side effects are,
Yes.
whatever.
Yep.
I know I had to have heard that because it's common in the language to talk about all
Right.
of these side effects. But now, in the studies that are being done, I work with a guy who had the exact same cancer, and he has the same thing. His immune system has also been wiped out. So I don't have an immune system anymore. But luckily, someone was smart enough to discover something called IVIG. So I
Right.
have IVIG every 4 weeks. So my counts go up, and then they go down. It's a bell curve. So it helps me stay healthy and be able to fight off things like a cold. I did have influenza A, which was terrifying this past January.
Yes.
Because
I did
healthy
too.
people were dying. So you know what I'm talking about.
I lost over 10 pounds in less than like 4 or 5 days. My son came home from college for Christmas.
And you brought it?
Yep. That was my Christmas
Great
present
gift.
that year.
Yeah, great gifts.
Wow.
It was wonderful. It was a wonderful gift, actually. When you had to go through the chemo, you had 6 rounds, and then you went on an oral medication. Then
No, it was so the rituximab was also delivered intravenously.
okay,
So right after I ended chemo, which my last chemo was November 27th of 2009, I said, you got to get rid of this port because I feel like I'm waiting for cancer
Right.
to come back. It's got to go. And it was a little wonky and it felt weird and it hurt, so I wanted it out. So we decided with this IV medicine, we would just use my veins. Well, chemo burns your veins up.
yeah, quickly.
I wish I would have thought it. I should have listened to my husband, and he will love to hear me say that. I should have listened to him.
He'll have to watch the
Yeah,
show.
he'll have to watch it. He'll be like, yeah, I told
Wow,
you.
a husband, right?
Yeah,
There's a
well,
new
I
one?
mean, it doesn't happen very often,
Nope.
so I'll give him that. So I did have to do it in my veins, and each time I did it, it did get a little bit harder
Yeah.
because
Oh,
the
I'm
veins were,
sure, yeah.
a little shot.
I feel the same way about my port. It's kind of like, mine's up in my left-hand shoulder here. Now as I'm gaining weight and I'm working out, well, I'm now growing in the chest area. Well, I didn't realize, but the skin's got to grow over that port too. So there is a little bit of pain
Yeah.
going on, but, and every 6 weeks you have to go in and have it flushed.
Yeah.
Like today I had to go in and have mine flushed this morning, which is really kind of nice. It's 5 minutes in and out of the office, and you get to see the wonderful nurses and the people that that take care of us, and so it's kind of like a nice little visit for me. But you're right, you roll over and you hit it, or my seatbelt is the worst for me.
So I with my IVIG, I still go to the cancer center every 4 weeks, and I have it done there.
Okay.
One of the volunteers came in, and one of my friends was there, and of course we're yucking it up because why not? And she asked me if I'd heard of a pillow port.
Yes,
And I
they
said,
make those.
I didn't even know about a pillow port.
Yeah.
So I have a port again. I had it put in this side for the IVIG,
Uh-huh.
and I said, put that puppy in there. So this thing is in there really deep. It is deep into my muscle.
Really?
So you bet. And it takes a 1-inch needle to access it every time. But so when I'm a passenger, my seatbelt bothers me. I just got a pillow port, and I haven't been a passenger since I got it, but I can't wait to try that thing out.
No kidding, me, yeah.
Do you have one?
No.
You don't
You
have
need to get one.
Oh, Jamie, I'll get you one. I'm actually going there tomorrow. So
Are you?
Yeah, I will get you one because there are volunteers that make them for
Yes.
people that have those. I didn't have a port. I had a PICC line, and we had to get it flushed out every week if I wasn't
Right.
getting anything. But PICC lines are for people mostly with leukemia, so that when you're done with your treatments, you can take the PICC line out. It's just in your arm, and it goes all the way to your heart, you know, close to your heart like your guys's does. But it's more temporary versus your, not permanent, but you know,
Yeah.
yours is just different than mine.
It's a
You
little-
probably
yeah.
know way more about it than I do, except I was able to get mine out when we were done with treatments.
Yeah.
So.
Yeah, and I figure if I have to do this every 4 weeks for the rest of my life, it's easier to just have a port.
Oh, exactly.
Yeah.
Exactly. And you are in remission. I mean, just so
yes,
we know.
Yes, I'm in remission. So my tumors are still there. They're not making me sick, and that's
Good.
the key. My bone marrow is clean, which that's really great
That's
too.
really good.
So do you have to have bone marrow biopsies?
Oh no,
Oh, okay.
no,
Good.
I was just wondering since you
no.
mentioned the
2
bone
in my
marrow.
life, that was enough.
Oh, yeah, I've had a few of those.
Yeah,
They are no fun.
Oh no,
No
sedation. That's the key
Yeah.
to that
Yeah.
bad boy.
Good drugs and sedation.
I see that your hair's short, so I had to ask her when she came. No, because I was like, I thought you were in remission, but she's loving the fun look of this.
So one of the most beautiful things about losing all of my hair anyway, because it wasn't easy at first, I learned that I can really pull off and rock a bald head if I need to.
Yeah.
My head is perfectly round, which who would have known? And I can wear short hair. Now, I did grow it out after I was all done.
Yeah.
I grew it out to my shoulders.
I did that too the first time.
Yeah. And I was
Yeah.
like, okay, well, that was fun. Now let's cut this off again. So I just kept going shorter and shorter and shorter. And it's easy. I actually was rocking a faux hawk for about a year. I actually just started doing it back into
How
a pixie.
cool.
Oh, it was so fun.
Oh,
and
and
it's
you
always
say
a
you
different
change your
color. Oh my
colors.
gosh. Yes. When you have short hair, like this is what you get to do, change your color.
Now, Jamie, I'm having thoughts again about my hair. We'll see.
I was like bleach blonde until I did this color.
That is fun.
Oh, it's
That
so
is
fun. It'd be brown. I've done dark reds, burgundies, whatever.
I was going to ask you because we were talking a couple of weeks ago about how the hair comes in. It comes in more curly, and
Yeah.
she was hoping hers would come in strawberry blonde
Yeah, I
or
was
something
hoping
like
to
that.
be a redhead.
Redhead.
You know, fire red.
Well,
Yeah.
okay, so the last
So
time
now
I'm
we know you can.
you could do whatever you want. I've got a
be
great
whatever
colorist.
color
She's
I know, right?
fantastic. Yeah.
great.
When I did the blonde, well, I'm really fair skinned anyway, and my eyebrows never really came back that
Right.
great. They're real thin and they're white. Like my hair is white. My hair did come back darker and curlier, so now we have to bleach it and make it blonde. So when I was the blonde the last time, people at work were like, "You look like sunshine." Yeah. So when I
Aw,
come with
that's
Fred, I
sweet.
go, "Well, sometimes I'm sunshine and sometimes I'm fire." So what do you know?
Sunset.
Yeah,
I love it.
It's
That's
fun.
great.
It's fun.
So your lack of energy and your hair loss, how did that make you feel, I guess, when you were going through the treatments and whatnot?
Well, I thought about the hair falling out a lot because I had such cute hair. I did. I loved my hair. It was so cute. And I, probably not unlike a lot of women, I
Right.
thought that my hair was, part of my personality. And when you see someone, you look at those kinds of features. And in my head, I was
Right.
thinking, I'm losing my hair, and this is a huge part of me. And what are my kids going to think? They're going to look at me, and I might freak them out. I might freak their friends out because my kids were kind of young when I was diagnosed. And thinking about it and blogging about it and just contemplating the day that I was going to get my hair shaved, because that was the recommendation. It was
Right.
falling out. We cut it really short anyway, but it was falling out all over the place, and it's a mess.
That's what I had to do too.
Yeah, well, I've come to understand that when I lost my hair, it wasn't really so much about the hair.
Right.
It was the fact I was not going to be able to deny that I was sick. that I couldn't say I have cancer. I couldn't utter those words. I could say they found cancer after a couple of weeks. I just couldn't say I have cancer.
Mm-hmm.
When I lost my hair, I couldn't fake it. I couldn't deny it. I had to accept it. And I'm a really positive person anyway, and for some reason, that signified something so much bigger than my looks changing.
Right.
Yeah.
And my kids were awesome. They were really awesome. I have a picture of me in my son's aviator sunglasses, and we first cut my hair into a mohawk, and it was something to be loved. It was fantastic. But the picture, I know that I was fighting back tears because I was just so freaked out.
Right.
And still not really fully understanding or recognizing the significance that I had to admit I was sick.
Yeah.
But then we shaved it all the way down, and then I thought about it, and I took a selfie. They weren't called selfies then, I don't think. Maybe in 2009, but whatever.
know.
I took a picture of myself, and I posted it with my buzzed head on Facebook, and I said, here I am. And I had to accept.
That gives me goosebumps.
Well, I just had to accept it.
Yeah.
And it wasn't as awful as I thought it was going to be. And then when it was squeaky bald, I did not wear a wig to work. I did wear a wig to work. I didn't wear a wig anywhere else.
Right.
The only place I wore it was work because I thought people would be freaked out by a bald chick because, you know, it's a little weird, I guess.
Yeah.
I don't know.
Yeah.
But my kids really embraced it and did a great job.
And these days, I got friends of mine that don't even have cancer that shave their head because they want to. So it's you know, you still kind of get looked at when you go into the grocery store, I'm sure. But these days, it's a little more fashionable actually to be bald as a woman. So that's pretty lucky.
Yeah,
I think of eyelashes. When I lost my eyelashes, that was harder for me than losing my hair. Getting ready for a game in September, a football game, and putting on mascara, which I have done, you know, in the majority of my life. And I'm looking in the mirror and I'm like, do I keep getting this mascara on the bottom part of my eye? And wiping it off with the makeup wipes and leaning in. And then I realized I had sticks for eyelashes.
I know. I remember. Well, the reason why I'm laughing is because my husband made fun of me one day because I was putting on mascara and I literally had like a hair here and a hair there, and that's it. And I said, you know what? It makes me feel pretty. Just leave me alone.
Leave it alone.
Yeah.
Just leave it alone. When we were rolling into October, when I was, you know, at the prime of my cancer treatment.
Yeah.
So I'm bald. My eyes are kind of sunken in because, you know, chemo makes you feel like crap.
No hydration.
Yeah.
Yeah, and my skin didn't look good, and I didn't have eyelashes or eyebrows. I totally looked like what's the guy from Cousin It? No.
Night Court or something like that?
No.
Adam's Family.
Adam's Family, that guy with the light bulb in his mouth. I can't remember his name.
Uncle
Fester.
Fester,
Yeah. So I looked like him. So for Halloween, we were going to get one of those light bulbs that light up, and we were going to go trick-or-treating with the kids, but I ended up with a fever and I couldn't go.
Aw.
But it was a great idea.
Yeah.
Because I really looked like him. I actually have pictures side by side of me looking just like him.
Oh, that's
That would be
funny.
great.
Yeah, you got to find humor.
So, with kids, you were diagnosed and your kids are young. How did you do all that? Handle being a mom, wife,
Well,
a person with cancer?
great support system. Hands down, that's the best. So I did call my pediatrician right after I learned that I had cancer. I said, I don't know how to do this. I don't know how to tell my
How old were
kids.
your kids?
Well, now they're 26, 20, 19, and 18. So this is 9 years ago. You know,
Yeah.
they were younger.
Yeah.
And my oldest son was at a family reunion with his dad, and my pediatrician said, I'll tell you this, you can't lie to your kids because they are smart and they will
Right.
figure this out. So my husband, we sat the three kids on the floor, and he said, well, we found out what's wrong with your mom because I had surgery. So I was in the hospital for a week before I came home, and then we had to tell the kids that what was wrong with me. And they were little. So Ryan is 20 now, so what was he, 11? So they were 9, 10, and 11, or 8, 9, and 11, 10, and 11. And my husband said, so they're going to do chemotherapy, and Ryan's eyes just became as big as saucers. And he said, that's for cancer. I thought, how do you know that? You little kid, how do you know that? And I thought, oh boy, she was right. We definitely cannot lie.
Yeah.
Then we had a friend of our family's that he said his mother died of leukemia when he was quite young, and they didn't tell him. They weren't honest with him about it. She was sick, and then she was gone.
Yeah.
And he said, don't do that to your kids. So we had open conversations about it. We had amazing friends. we had a barbecue shortly after I was diagnosed, and I couldn't believe all the friends that came, and like they wanted to clean my toilet, and I was like, I don't want anybody cleaning my toilet. That's weird. And our kids were active in sports, so they wanted to run our kids around for us, and it was really humbling to accept that help. But what I came to understand in this whole journey is that's how my friends and family felt like they were part of my fight.
Right.
They want to help.
Right. I knew what to do. I knew to go get chemo, and I knew that I'm not going to feel good, and that was my job. My husband's job was to cook and clean and take care of the kids and be the coach of all the athletic things that he did. And my friends' jobs were to run my kids around, bring us meals, clean my toilets, fold my towels.
Yeah.
I mean, it took so many people to help in the process. But it was not just me alone. There were a lot of people in my life, work, family, friends. We were very, very fortunate.
And I think that support system's huge with anybody going through this, because it just lets you know you're not alone, and it alleviates some of that stress that's unneeded, because you know that people are taking care of things that you normally do and don't have the strength to do yet at that moment.
Yeah, the fatigue that you experience as you get more and more chemo in your body, it is just incredible. And I had a friend that would drive me to work because chemo brain's real, as you both know.
Yeah, very real.
Very, very real. And
What?
Yeah. Where did I park? Oh, she would pick me up and drive me to work and drop me off outside of the building and pick me up outside of work so that I didn't have to walk the 2.5 blocks to the office.
So nice.
There were days when I didn't know if I could.
Yeah.
But I worked the whole time.
I didn't work the whole time because I could not be, my immune system was compromised, so I couldn't be around people. And I'm a teacher, so you have all those children, But, I know Jamie worked.
Yeah, and I had a nurse that was working with me, and she would literally send me home during the day. And she would pick me up at I only lived like 2 blocks from my office. And so I used to walk every day until I got really knee deep into chemo, and like you said, you just get so fatigued. But she would come pick me up, she would bring me home for lunch, and then she'd make me stay at home and go, all right, I've got the clinic for the rest of the day, and she would. Her name was Brenda, one of the most amazing support systems I could have ever hoped for, and she just showed up at my door one day.
God must have known.
Yeah, absolutely.
So what made you stay positive throughout all of this then?
I've kind of looked at this as I really had 2 choices, and I had to simplify it that much. And I had either the opportunity to fight or lay down and die. That simple. Get up and fight or lay down and die. Well, I wasn't going to lay down and die. I was 38 years old, 4 awesome kids, not doing that. Yeah. So to me, in my brain, I made it that simple. And I don't know, I tend to look at everything in a very positive way anyway. I may not ever know why this was my journey, and that's okay. I don't necessarily need to know why it was my journey. The gifts that I got in this journey and that my family got in this journey, I would never trade them for anything. I don't want cancer back, but I would never trade looking at things differently, like really, truly what is important and where do I want to spend my time and my energy. And, somebody cutting me off on the way to work is not that big of a deal, where it may have been pre-cancer.
Yeah.
Yeah.
I don't know. I just
you learn to not take for granted the things, and you have a different perspective on life. I used to look at my children and be like, oh, I never took the time to watch them on the swing outside our door, or outside the window because I was busy doing stuff. Well, now I take the time to do things like that. Or if they say, Mom, I want to tell you about my day, I take the time to listen. Now, sometimes I have to finish something. I mean, like other parents have to do too, but it's just really nice to not lose that perspective.
Yes.
Yeah, and it's in some ways I'm sad that it took cancer to get me there, but at the same time I wouldn't trade it.
Right.
I wasn't maybe the most understanding person before. Well, that's not true. I've always been an understanding person, but my mom got diagnosed with cancer after I had cancer. And she died in 2012. And her battle was very short, 4 months, small cell lung cancer. And had I not had the experience of being absolutely beyond sick from chemo, I never would have appreciated or understood that she really was that sick.
Yeah.
Because I would have been like, come on, Mom, toughen up, get up, because that's how we were as a family.
Yeah.
And instead I could say, you know what, it's okay that you can't eat this food that you can smell because it's making you sick. I understand. Because I understand. I don't know that I could have done that kind of empathy before.
It's a
I
whole new
completely
level
agree.
of empathy that, you know, we're just never taught until you thrown into that situation. You know, I've been a nurse for almost most of my life, 40 years on coming up now. And I was always on the other side of the bed, and it was, you know, now I understand what it's like to be inside the bed. So we're gonna wrap this up in a little bit. Is there anything that you would like to tell everybody out there?
Eat dessert first. Eat dessert first. Indulge. Take the time to let other people help you if you're in a cancer battle. I think that's very, very important.
Yes.
It's not like they're feeling sorry for us. It's how they're feeling like they're part of it to at least help us in some regard. Slow down.
Yeah.
Enjoy the little things.
Smell the roses.
Oh, absolutely.
It's so easy to get caught back into the busyness of life.
It is.
Very easy. So sometimes I even have to remind myself to slow down.
Yeah, well, the further away I get, the harder it is sometimes to remember that. So then I get to do things like this that causes me to remember.
Thank you. And
Yeah.
Carrie,
Well,
thank you so
it's
much for being
such an
on
honor.
our show.
Thank you for asking me.
Yes, thank you so much.
You're welcome.
Yeah. And I hope everybody comes and joins us again on Candid Chats for Candid Chats for Cancer.
And we'll be chatting with you guys on the next episode. Y'all have fun.
says
Have a
yeah.
nice one. Bye.